Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to take a look at the top things that you should be able to do before trying to return to running or jogging after your knee replacement surgery. Hey everyone, so as always, I want to lead off with a quick disclaimer that when it comes to jogging or running after knee replacement surgery, a lot of surgeons and probably a lot of physical therapists out there will say that you probably want to avoid it and not necessarily do it. And I would never go against the advice and recommendations of your surgeon. I would listen to your surgeon and what they have to tell you and what they recommend. I would also say that running after knee replacement surgery is not for everyone. It's for kind of a select few people, but there's definitely folks out there who do return to jogging or running in some fashion or another. And so I want to share some tips on how to be able to do that effectively and safely after having knee replacement surgery. So as a physical therapist, I take a look at basically what I'm considering as prerequisites. So certain goals, certain things that need to be met before I'm gonna say go ahead and try to jog, try to do a little bit of running after having your knee replacement surgery. And so let's quickly run down a list of what some of those prerequisites are that I look for in some patients before I say, okay, let's give it a try. First is time. So I want to wait at least 6 months after your knee replacement surgery. Why 6 months? Well, it's kind of just a best guess, best estimate based on timelines for other surgeries, ACL reconstructions, things like that. It also just gives enough time for your body to heal and recover to a fair enough, significant level that you're able to tolerate something like jogging or running. So at least wait 6 months until after your surgery. The next thing is you want to be able to have very little to no pain with just your normal daily regular activities. If you're someone who you're still walking around throughout the day and you have moderate to significant pain in your knee just with walking or doing your normal daily tasks, then we don't want to start to increase the stresses and increase the forces on your knee even more by returning to jogging. Get everything under control, get that pain level down, get those symptoms down before you even start to think about returning to something like jogging. So that's number 2. The next thing is you want to demonstrate that you're able to tolerate kind of a prolonged level of activity. So what I like to have people do is just 20 minutes to 30 minutes of brisk walking. So if you can't tolerate 20 to 30 minutes of brisk walking, you have this increased knee pain, you have swelling, you have discomfort, you have stiffness, you have other things going on, then you're not going to tolerate going back to jogging well either, even if it is just a short duration. So build up that tolerance to kind of an aerobic activity, aerobic movements and exercises by building up that tolerance to being able to walk 20 to 30 minutes without significant increase, probably no increase to minimal increase in pain and discomfort after 20 to 30 minutes of walking. So that's another goal as well. And then after that, I take a look at some certain exercises. So certain things that are going to be challenging in similar ways that jogging would be. So one is calf raises. So standing and basically going up on your toes, lifting your heels up and down. So I look at people, for example, someone who is doing that bilaterally, so doing it with both feet, being able to do 20 to even maybe up to 30 calf raises continuously at one time without any increased pain, increased discomfort. I also may look at doing it single leg calf raise. So perfectly okay if you're holding on to something for stability, but doing a single leg calf raise and being able to do maybe 10 or 15 on each side as well. So that's just showing kind of basic strength through the legs as well. Another thing I look at is just strength in general. So this is going to be a little variable for everyone, but for example, I may look at doing a squat or doing a leg press machine if that's a little bit safer and easier to perform. And it's going to be individualized by each person, but basically kind of figuring out what's that benchmark level of strength through your quadriceps, through your hips, that I want to be able to see that you've achieved before starting to add more of that dynamic plyometric movements of jogging and running. So a baseline level of strength is very important. The next thing I would look at is balance. So are you able to balance on one leg? Are you able to do that for maybe 10 to 15 seconds at a minimum? Being able to balance on one leg up to 30 seconds would be awesome and be great, and we're looking at both sides. But at least getting 10 to 15 seconds of being able to balance on one leg, that's showing you have your balance, stability, coordination, a lot of things that are going to be helpful and beneficial when it comes to jogging and running. And then I want to start to kind of lastly incorporate some very gentle, very light plyometric movements. So running and jogging is a little bit, debatable, but you can consider it a plyometric type of activity just because of that kind of forces and the bounding that is going through your legs as you jog. It's probably obviously not as significant as doing jumps or cutting and sprinting and things like that, but there are those forces at play. So basically things like looking at someone standing in place, and can you just bounce up and down on your toes? So lifting the heels up and down. So instead of doing just a slow heel raise, you're kind of doing this bounding or bouncing motion, checking the elasticity, checking the ability to tolerate that motion. And then from there, if you tolerate that okay, then I look at, can you do some hopping in place? So can you hop in place with two legs? And can you do that for maybe 20 seconds or 30 seconds at a time? And then can you hop on one leg for maybe 20 seconds or so, or maybe even a little bit more, and checking both sides again. And then I may start to incorporate, make it a little bit more dynamic. Can you bounce, or can you hop back and forth, forward and backward, 20, 30 seconds? Can you hop side to side, 20 to 30 seconds? Things of that nature. Just doing some light plyometric activities that make sure that you can tolerate the forces and the movements of jogging and running. And so if you're able to tolerate all of that, that's awesome. That shows that you're able to at least give it a try. It doesn't mean you're necessarily going to be super successful. It still means it's going to take time. It's going to take a slow progression, slowly building up, and also just being realistic about it when it comes to jogging after surgery. You've had a knee replacement. You're a little bit older probably. You have to be realistic and have realistic expectations, but jogging and running is definitely not out of the picture. And so when you do return to jogging, just a quick thing beyond the scope of this video, but you're going to start to incorporate walk-run programs. So doing periods of intervals of walking and then running or jogging, walking, jogging, walking, jogging, starting to build up that tolerance for jogging instead of just going and jogging 2 miles right away or whatever you want a distance to be, building up with a walk-run program. And then there's also what we call soreness rules. So that's looking at, basically very simplistic explanation is, after doing a walk-run program or a session, does your pain increase? How long does the pain increase for? Do you have any other symptoms? Swelling, stiffness, achiness? How long are those increased for? And kind of based on how your body and how your knee responds, that's how we focus our progression, returning into increasing that volume very slowly and in a realistic manner. So thank you very much for watching, everyone. I hope this provided some useful insight for any of you out there who are considering or trying to get back into jogging. Again, the main thing is take it slow and progress in a step pattern realistically with realistic goals, realistic expectations, and you'll be okay. Be sure to subscribe. Be sure to leave a like below. Any comments and questions that I can help answer, I'm happy to help. And like I just said, be sure to subscribe so you can catch all our videos related to knee replacement surgery, exercises, frequently asked questions, everything else in between. Thank you for watching.